Hello, I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yeah, I am Mr. Edward Jenner, 40 years.
Nice to meet you. How can I address you?
Hello, doctor. You can call me Edward.
Okay, Mr. Edward. I have got a letter from your GP saying that you have high blood pressure for last 3 months. Is it right?
Yes, doctor. Yes, I have been having some blood pressure issues for the last 3 months, and actually, it was all on a sudden that that my pressure was diagnosed. I was just not. I was a bit astonished, but the doctor told me that I had quite high heart blood pressure. So he gave me some drug medication, and after taking that medication, I have always been taking the medication regularly. And after taking that, came to follow up with it, and to my surprise, I knew that the pressure was not that much controlled. It was 190 by 90. So my doctor added a second drug. I think the first drug, I think it was atenolol. The second drug, I think it's ramipril. Okay, so even now also now the pressure has not decreased. The most recent one was 190 by 85. So I have read through some net that uh, two drugs is usually more than enough to control the blood pressure. So what's happening with me, doctor? I don't know. Why is this?
Okay, let me take detailed history. And I am going to ask you a few questions, and all the information during my discussion will be remain confidential. So is that okay for you?
Yes.
Okay. So in first case, why did you visit the doctor? Was there any problem or anything?
Well, doctor, I think that I just felt some type of dizziness at times. Okay, and also I just occasional. I think sometimes I had some headache problem. Nothing else. So I just went to visit the doctor that what's going on, and he at that time measured my blood pressure and told that I have high blood pressure.
Okay. And you said about your headache. Can you tell me more about that?
Well, it was not specific, doctor. It just comes and goes. It's not that there is any regular routine in it. Sometimes there is some sudden headache, and at times also I feel that there is some racing and pacing of my heart. Although it's regular, but I think it's a bit fast heartbeat, and also that headache. So that actually frightened me. That what's going on.
Okay. So can you tell me the where do you feel the headache?
I think, doctor, it's more or less in the whole head. I think I cannot specify.
Okay. And can you tell me that how do you feel the pain? Was it very severe? And is it throbbing or some?
Not very severe, doctor. I think it's mild, but I think it's some type of continuous pain as long as it stays. There is no increasing or decreasing, just irritating pain.
For how long the headache persist?
10 to 15 minutes, doctor.
Have you noticed that anything makes it worse or better?
No, doctor, I haven't noticed it.
Do you feel any warning shot before the headache comes, like any changes in the vision or any abnormal sensation?
No, doctor.
Okay. And after the headache, do you feel any after effect?
No, doctor.
And you said that you feel a racing and pacing of your heart. Do you feel it during the headache or after or before the headache?
Yes, more or less during the headaches.
And for how long this racing and pacing persist?
Yes, again for 10 to 15 minutes, I think.
And do you feel dizziness at the time? Any that is any abnormal sensation?
No abnormal sensation, doctor.
Okay. Any tendency to fall down at that time?
No,
Have you ever lost consciousness?
no, doctor.
Okay. And you have said that your racing and pacing is regular and it is somewhat faster. Have you ever noticed anything irregular?
No, no.
Uh, Okay. Do you feel any morning headache?
No,
And how many episodes you felt over the last 3 months?
I think in the last month I had 3 episodes.
Okay. Do you have noticed any changes in your vision?
No, doctor.
Do you have any problem with your mood?
No,
How
I'm
about
just
your
worried about it.
and how about your appetite?
Quite good, doctor.
And have you noticed any changes in your weight?
No,
Any lumps or bumps anywhere in your body?
no, doctor.
Any feeling of throwing up?
No,
Noticed any lumps in the neck?
no, doctor.
Any hot or cold preferences?
No,
Any chest pain?
no, doctor.
Any shortness of breath?
No,
Any cough?
no.
How about your bowel habit?
It's quite good, doctor.
And your water work?
Good.
Any weakness at any side of your body?
No, no,
Any rash?
no,
Any skin stains?
no,
Okay. And do you have any past medical condition that you would like to share?
no, doctor.
Uh, do you take any other medication except those Remifril and Atilor?
No, doctor.
Any over-the-counter medication?
No,
Any herbal products?
no,
Do you have any allergy to any medication?
no,
I'm sorry to ask, but do you ever try any party drugs or any other recreational drugs?
no, doctor. No,
Do you take any gym drugs or any fitness drugs?
no, doctor.
Any of your family member have this type of condition or any condition that runs your family?
No, no, doctor. I don't know of any.
Any history of early death, childhood death, sudden death?
No, 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 no,
Any history of cancer in your family?
no,
Any problem with gland in your family?
no, doctor. I don't know of any.
May I ask you a few more personal questions?
Yeah, of course.
Do you drink alcohol?
It's in the social limit, doctor.
That is fine. And do you smoke cigarette?
No.
Okay, may I know that what do you do for a living?
Well, I am a solicitor, doctor. I'm a solicitor.
Okay. And do you drive?
At times, doctor.
And do you drink excess coffee or tea?
No, doctor. No.
Do you want to add anything else at this point?
No, doctor. Why this pressure is not under control? There have been two drugs, strong drugs, but still it's almost same. And I have been having those drugs completely regular. So yet these problems are not going off. So why so?
Uh, Actually, I need to examine you at this point, then I could give you the best explanation. But there are few possibilities that can happen with your case, as you have high blood pressure, and you have sometimes headache and some racing and pacing of your heart. So, can you remember that? Do you feel any excessive sweating when you feel headache?
Yes, doctor. Yes, at times when I have this headache and heartbeat, I sometimes feel that I sweat a bit more.
And do you feel any shakiness of your body?
No, doctor.
Have you noticed anything that any frightening or any anxiety or any stress that breeds this condition or not?
No, doctor. I have not noticed such.
that is not a problem. So with this condition that you have headache, you have racing pacing of your heart and excessive sweating, and also your high blood pressure is in control on medication, that brings a few possibilities that there might be some problem with your gland. So that is producing excessive hormone we call excessive products that is causing you the symptoms. So we need to do some blood test, some test of your water, and some imaging test. Do you get me?
Okay. Okay, doctor. Well, what is the treatment for it? Yeah, is it treatable?
Okay, actually, at this point, I am suspecting a condition that is called pheochromocytoma, and it can be treated on medication. But first, we need to uh, get those test results, and after that, being confirmed that actually what is happening with you, we will be in touch with you, and we can give you the best advice on that.
Okay, well, okay, that's all right, doctor. Thank you.
Thank you.
Okay. So, what is the diagnosis, you think?
For this gentleman, I think a few pheochromocytoma cause.
Okay, okay, that's all right. And what do you think can be should be the investigations in this patient?
For this gentleman, I will go for the baseline investigations, and apart from that, I will go for the ECG, echocardiogram, chest X-ray, then random blood sugar level, serum electrolytes, and also after that, I will go for 24-hour urinary metanephrine level. And also, I will go for the ultrasonogram of whole abdomen, and I may need for CT scan of uh, abdomen, and then if it is inconclusive, I may need to go for MIBG scanning.
Okay. So, what is the treatment that you think?
It is actually a multidisciplinary approach. I will involve, if it is a case of pheochromocytoma, I will try to find out if there is any association with multiple endocrine neoplasia. And after that, I will involve endocrinologist and surgical team, and they will decide if it needs any surgical resection or any other medical management.
Okay. Do you think that before surgery there should be any drugs given in this patient?
Okay, before surgery, we'll for controlling of blood pressure, both alpha and beta 2 antagonist drugs, that is phenoxybenzamine. I forgot exact name.
Yes, it's Benjamin. Okay, that's good. And okay, that's actually that's been a very good case. I think that's all. And but there are some issues. First of all, that I think when you delved into the case, you found it that it's pheochromocytoma. That's very good. But after finding that it's pheochromocytoma, I think for main syndrome you should have asked more. Suppose any changes in body shape, any how is it more height or not, malformed habitus, okay, any changes in skin you asked, but again about his gland problems and also his pituitary problems, I think all those should have been asked a bit more, okay. And again, pheochromocytoma can at times be associated with neurofibromatosis, okay. So acoustic neuroma about his balance, okay, cerebral function and eye movement. I think this could have been asked. Also, these include about pheochromocytoma. But again, in this patient, you know that there can be some more secondary causes involved. Okay. So for this, like for Cone syndrome, I think you should have asked, is any muscle cramp present or not? Okay. For Cushing's and Cones. Because hypokalemia can cause some muscle cramping. And again, I think you missed another, that is acromegaly. Any changes in glove size or any changes in ring size. Acromegaly can also cause some hypertension at times. Okay, so I think these two has been missed. but I think muscle cramping should have been asked. Okay,
Yes, yes.
for excluding for excluding Cons syndrome, and okay, and I think most other causes have been evaluated, and I think it's been quite a good case. And do you want to add anything?
No.
Well, so I think it's been quite good.
For this
I
patient,
think,
driving issue should be.
I think we can de-shoulder it because his blood pressure is actually quite high. So I think we can say that you might need to inform the DVLA, uh, or we will speak to the consultant whether DVLA should be informed or not. I think that would be enough, no, because there is no problem in his vision. I think, okay, so there is no loss of consciousness, no problem in his vision. So I think I'm not sure whether DVLA must be informed in this case, or they should be informed. I don't know whether it must be informed or should be informed. So I think it's better to de-shoulder, I think.
Okay, okay. Thank you.
Okay. Okay. So any more questions?
For this, this is a
Okay.
straightforward case. So,
Yeah.
do we need to go for other? Do we need to find out other causes of secondary hypertension, or just we'll go for the focused investigation?
Well, this is actually quite a clean cut case, okay, of pheochromocytoma. But I don't think that once you just go once you are close to your diagnosis, I don't think that we should burden the patient by doing all the investigations. Okay, I think it's better to at first go for a more focused investigation, and later on we can involve multidisciplinary team and our consultants, and they might decide whether more broad spectrum investigations can be done or not.
Okay. Thank you.
Okay.